So it's very interesting what's happened over the years. We've gone from, obviously, the major boom in the pharmaceutical industry was broad spectrum antibiotics. Patient comes in, you're not sure what they have a gram-negative infection, they have a gram-positive infection. I give them a broad agent spectrum that covers everything. It's a wonder drug. That's what we did historically, and because of that, we've sort of backed ourselves in the corner that once one of the bacteria become resistant to that, all of a sudden this broad spectrum agent doesn't have such a broad spectrum, and what you end up starting to do is you start filling in the gaps with narrow spectrum, and now the bugs have become so resistant that the broad agents don't work anymore. And this is the problem with the pharmaceutical industry, because obviously if you're a pharmaceutical industry, the broad spectrum drugs make a lot more money than a narrow spectrum drug because you can use them on almost any patient who walks in. The fact that we've had so much resistance, now the narrow spectrum drugs are what we have to make, and obviously their use is less, their ability to actually work is become more problematic because they're focused on very drug resistant strains who have the ability, just because they basically have been exposed to so many different antibiotics, that they develop resistance quite quickly. The one thing we'd love to do is to develop what we call novel agents, which means a whole new family of agents. They're just very hard to do. And the idea that the pharmaceutical company, they're good at what they do. They've done this for a long time, and the idea that they can just, snap their fingers and say, okay, we'll come up with a different strategy. They've been doing this a long time, and they've basically exhausted a lot of compounds that are out there. So even revisiting old drugs, which is something we do, we still find ourselves trapped in this idea, yeah, but resistance really is still going to thwart this new compound, mainly because these bugs have seen this compound just in a different version. So it's not like they haven't been exposed to this. They have, but it's not exactly the same thing, but it's related enough so the bacteria actually have resistance mechanism. It's quite frustrating for the pharmaceutical industry just because the challenge is so high, mainly because we've created this problem. The sad thing is the bacteria that we're going to encounter today is not much different than the bacteria our grandparents encountered 60 years ago. The difference is that bacteria is now drug resistant. So the superbug idea is really not the bacteria haven't become more virulent, it's just that we just can't treat them as well as we could years ago because we don't have the same agents that are available.